Welcome to Section 3 of Carbohydrates, Blood Glucose Regulation. I want to explain blood glucose regulation. I'm going to use this diagram. So first I'm just going to orient you. This is going to represent the bloodstream with these representing glucose as they have throughout this lecture series. Our liver, intestines, fat, muscle, and pancreas. They are obviously not in this order in the body, but this is just a diagram to help illustrate some of the concepts. So again, I'm going to start with the bagel. And again, I like to use the white bagel because it is a perfect example of a very highly refined product. It has mostly starch with just a little bit of protein and fiber, a few other nutrients, but is very easily digestible. And when you eat the bagel, and as it goes through the intestines, remember it goes from starch to the glucose change to maltose, very quickly digested, and ends up in the bloodstream as glucose. So when you eat a bagel or a highly refined product, such as a bagel, the blood sugar goes up. Now, how does the body respond to this? Well, the pancreas is going to release insulin, and insulin is represented here with the I, and this insulin is released in response to high blood glucose. Now, insulin's role is to assist in the transport of glucose into the cells, particularly the muscle cells and the fat cells. The glucose then leaves the bloodstream and goes into the cells. So as the glucose is leaving the bloodstream, all these glucose are now going to be going into the cells. It's going to bring the blood glucose back to a normal level. So the goal of insulin, our storage hormone, is bringing that energy in the form of carbohydrates, in the form of glucose, into the cells so it can be either utilized or stored. So insulin's a storage hormone. We like to think about it that way. So now we're back to a normal blood glucose. So let's think about the opposite. So instead of having your bagel for breakfast, maybe you skipped breakfast or you skipped a meal and you didn't eat. Well, how does the body deal with that if you're not eating? The body has a fantastic way of dealing with this. If you skip a meal, the blood sugar does go down. So now you don't have that form of energy, carbohydrate energy, in your bloodstream for the cells to use. Blood sugar goes down. Now, this is, of course, going to stimulate, make you a little lightheaded, maybe fatigued. You definitely will get a little bit get hungry. But your body can respond to this. You don't necessarily always have to eat right then because the pancreas is going to release glucagon. Glucagon is a hormone that's going to tell the liver to release glycogen. Now remember, glycogen is our storage form of glucose, our storage form of carbohydrates, mainly stored in the liver and the muscle. And the liver likes to share its glucose, share its glycogen. So once the glycogen is released, it will then break down, remember, into glucose. So what will that do? That is then released into the bloodstream, and we bring the blood sugar, the blood glucose levels back to normal. So again, your body has a way of dealing with high blood sugars and low blood sugars to bring them back to normal. Now, if you're eating whole foods, and they're whole foods, high fiber, I say low sugar, but also low starch, low refined products, then you're going to have a slower absorption of glucose. So remember, we just went through the digestion and absorption process, but when you eat really refined products and sugars, they're going to go into the bloodstream very quickly. But if you have something with high fiber, also if you have a mix of whole foods with protein and fat, it's going to slow the absorption of glucose so you don't get that big spike of sugar in the bloodstream. So then insulin and glucagon will still be working together, but it's not going to be these really high and really low spikes. Now let's go back to our bagel example. The bagel, high starch, it digests very quickly. It absorbs very quickly into the bloodstream. So you eat this bagel, and boom, you have a bloodstream full of sugar. Well, the body's going to respond to that. It doesn't want that high of sugar. The pancreas releases insulin. So now the bloodstream is full of sugar and insulin, glucose and insulin, right? Well, what's insulin's job? It's a storage hormone. It's going to pull this sugar out of the bloodstream. It wants to get it back to a normal level. It wants to bring it into the muscle if it needs it for use, or it'll bring it into fat to be stored as fat. Remember, it's a storage hormone. So bagel, starch, goes to glucose change, maltose, glucose, high spike in your blood sugar, spike of insulin. Then the insulin works, drives the glucose out of the bloodstream, and leaves us with just a little tiny bit of sugar. Well, what does that do? It makes you tired, makes you hungry, right? So then what happens? You eat the bagel and you feel high, you feel good, you always have the sugar buzz because, right, it breaks down into glucose, which is our form of sugar, and then that sugar gets pulled out into the cells. You know, if you're sedentary, it's going to just be stored as fat, and then you drop back down again. So now you have that sugar low. Now you're tired. You're thinking, I'm hungry. So what do? You eat the bagel again. So now you're feeling good again for that little bit of time. And then again, you have that sugar low. So even though it's not sugar, it's still, I call it the sugar buzz, the sugar low, that feeling of tiredness and fatigue after eating. And it could be a lot of calories. On to diabetes drugs. Remember, when there is high blood glucose, there is a release of insulin from the pancreas. Sulfonylureas, such as glyburide, increase the release of insulin, which decreases blood glucose. Glynides, such as prandin, also act in this way by increasing the release of insulin, which decreases blood glucose. Biguanides, such as glucophage, decrease the release of glucose from the liver. They may also increase glucose use by the muscles. The less glucose released by the liver, the lower the blood glucose. We know that type 2 diabetes is characterized by insulin resistance. Insulin assists in the transport of glucose from the bloodstream into the cells. But if the cells don't recognize insulin, the glucose cannot be brought into the cells. This is called insulin resistance. Fludazones, such as Avandia, reduce insulin resistance, meaning they increase insulin sensitivity. Insulin can do a better job of bringing glucose from the bloodstream into the cells. So this means there's a lower blood glucose. Alpha-glucosidase inhibitors, such as Prelose, decrease the absorption of glucose from the small intestines. The result is lower blood glucose. Let's take a look at incretins. Incretins are hormones released from the intestines in response to food. The main effects are to stimulate the release of insulin from the pancreas, preserve beta cell function, decrease appetite, and reduce the secretion of glucagon from the alpha cells. DPP4 is an enzyme that breaks down incretins. DPP4 inhibitors inhibit DPP4 enzyme. This means that the action of incretins are prolonged. DPP4 inhibitors, such as Januvia, increase the effect of incretins, which means that they will increase insulin, decrease glucagon, and decrease appetite. They also may preserve beta cell function. Incretin-like drugs, such as Byetta, increase the effects of incretins to increase insulin and decrease glucagon. And they may also help preserve beta cell function. Amylin is a hormone that is secreted by the beta cells of the pancreas. Amylin increases intestinal motility, which reduces appetite, slows the rate of glucose absorption, and reduces the release of glucagon. Amylin-like drugs mimic amylin, and this means that it will decrease the release of glucagon, slow glucose absorption, and decrease